Kansas is having a tuberculosis outbreak, and it's a pretty big outbreak. It seems to be focused mostly in 2 counties that have quite a few active and inactive cases of tuberculosis, and unfortunately 2 people have passed away. Since last year in all of Kansas, there have been 79 active cases of tuberculosis and 213 latent cases. In just these 2 counties, though, there have been 67 active cases and 79 latent or inactive cases. Tuberculosis is airborne spread, so people cough, sing, talk, and spread these little airborne droplets into the air. They unfortunately can kind of linger in the air, and if someone else breathes them in, they have the potential to get infected. Symptoms are coughing, which can last up to 3 weeks. You can cough up blood and phlegm. You can have chills, fever, decreased appetite, fatigue. You can have weight loss, chest pain, and you can have night sweats. If you have inactive or latent tuberculosis, you can have the infection in your body, but it is not causing any symptoms. But at some point, it can activate and then cause you symptoms. Treatment for tuberculosis can be anywhere from 4 to 9 months in duration, and a lot of times multiple medications are needed because of resistance that's developed. There is a vaccine called the BCG vaccine. We do not give it here in the United States, and it has variable effectiveness. Generally, people in group settings are in higher risks, things like jails, prisons, shelters, dorms, barracks, etc. The CDC has been dispatched. The Kansas Department of Health and Environment is doing contact tracing, treatment, and testing, and there are 384 people who are currently being monitored. The risk is generally considered low, even for people living in these 2 primary counties, but if you are symptomatic or you've been exposed, you should chat with your doctor and the health department.